Yes, so I'm going to change our gears a little bit because I want to thank my colleagues for really giving us a lot of good data and context for this conversation on multicultural health. And I want to thank Dr. Nuys for bringing us all together and allowing for such a diverse type of voices to enter into this discussion. So I work for Momentum Solutions. We're an agency that's focused on social impact organizations and helping them develop their branding and messaging and also providing coaching. But before that, I was an employee of LA Care Health Plan, and I've actually been working with LA Care Health Plan for about 10 years when all is said and done. So I'm a marketing communications professional, and I think in my talk, you're going to see that this is really sparse. The next slide is probably going to be the one that has the most words. And it was intentional because I wanted to have a conversation with you about what this looks like from a very personal, individual level. The token Hispanic. So early on in my first job out of college, I was, optimistic, idealistic person coming into this new world. And one afternoon, a vice president walked by with a couple of other leaders and a vendor and introduced me. This is Gabriela Torres, and she's our token Hispanic. It took me a minute because a lot of things that I had thought and felt suddenly were very real. So it was a lens that I didn't have before. And what that did for me was actually a lot of really good things. I understood that I was the other, right? So that the system that I'd grown up, born, raised, educated here in California had pushed me aside for some reason. The second thing is that there was some systemic, institutional, and organizational dynamics that made this okay. That this person did not even blink, and neither did the other people. There was a few glances of discomfort, and I was also kind of silent. I'm sure I made a face because if you want to know what's going on, just look at me, it'll be clear. And it was just an awkward moment, right? That shaped my future and my career. Because the other thing that it did was introduce me to a career option I didn't know I had as a path. So now I was entering into multicultural communications because as a token Hispanic, I also became the resident expert on all things Latino, even though I didn't have that lens other than my own upbringing in a Mexican household of first generation Mexican immigrant parents. So what I did to sort of support this new role I had been assigned, I was a little pissed, I was a little frustrated, I was a little annoyed. I got my degree in Latin American Studies because I wanted to really understand the historical dynamics of this engagement and not just understand my own history from Mexico, but understand the dynamics from Mexico all the way to Argentina and how long this relationship and this interaction have influenced that one day, right? Because it's a macro view. This is not a new concept, and it's much larger than we ever really take the time to know. But we operate here in this community, and this is the context. So I wanted to communicate to you that the language that you use as you're building your policies, as you're building your initiatives and your programs really matter because it has a lasting impact. Every time I have been invited to be a speaker or a panelist or a group to discuss diversity, this is the first thing I think about. Right? Because it's informed, it's added a lens for me so that as I move forward in my marketing career, I always have this antenna of making sure that the communications that I help create don't exclude as much as is possible. And the first thing I can do to shape that is the language that I choose to use. So we are all powerful in that way, because in the conversations we have on a daily basis with our friends and our family, our colleagues, our volunteer opportunities, we have the opportunity to change the conversation, to change the language, and start to chip away from a different perspective, because there's some large initiatives going on. You've seen all the data of all the disparities and equity, but we can all work together from our place right here to make sure that the shift is happening, right? So it was probably no surprise that I ended up at LA Care. And this tie concept, it was just for me, a way for me to organize my thoughts, because another colleague kindly informed me that I tend to babble on. And that's just because I get excited and there's a lot of things to talk about. So LA Care, for those of you, how many of you are familiar with LA Care Health Plan? Okay, good. 2 million members, meaning that almost 1 out of every 5 residents in LA County is a member of LA Care. We've been around for 20 years, and we're mission driven. And the vision of LA Care is for there to be healthy communities where everybody has access to the health care they need. So TIE is my concept to sort of describe our communications and marketing journey, our external journey in communicating, taking all this data, all these initiatives, all these things that we want to change and improve, and translating it so that anybody can access it and understand and feel connected to it. Because when I like to think about campaigns, I like to think about how is this image, this tagline going to work at the dinner table at home when you've come home from work? How are you going to engage? How are you going to talk about that? How is that going to impact when you had to deal with all these things all day long? So I'm thinking about a campaign, and I'm thinking about, are we going to start a conversation at the dinner table, and what does that look, sound, and feel like, right? So my first exposure to LA Care was as part of the advertising team that did their first advertising campaign. So it was a transaction, because a lot of people didn't know who we were, and we were trying to figure out how are we going to communicate really fast in 30 seconds or less that we're here, that we're a health plan, and that we're committed to your medical needs and a healthy lifestyle. So this first campaign was lovingly called the Oranges Campaign, and we were actually using real oranges in our ads. And it was inspired by the Free Hugs video. Do you remember those videos where people stood with signs that said free hugs? Okay, so that was the inspiration. Our orange sort of became our hug. So here you have access to healthcare if you can't afford it otherwise, and we're gonna have this transactional relationship. Orange, healthy California. It crossed a lot of cultures. It didn't really stir the pot any one way with gender or all these other communities, and you understood really quickly how LA Care saw itself in this game, right? Access to healthcare for everybody, and our tagline was for a healthy life. So it was, we're LA Care, we're here, call us. That was it. The next level came when the Affordable Care Act passed, and we as an organization discussed, LA Care as an organization discussed whether or not we would enter covered California. And it was kind of a no-brainer, because it would be the first time that we would be able to serve everybody in a household. Before that, as a Medicaid administrator, most of the people we served were moms and kids or seniors, because we also had a special needs Medicaid plan. So we had to reconfigure how we saw ourselves. We had to think about this perception of Medi-Cal and Medicaid, right, which is negative poor people, low quality, and really be thoughtful about how we expressed what healthcare represents, because it really wasn't low quality. Or we did serve low-income families, but it was a tool you had to improve the quality of your family and your own life. So then we moved on to the interaction piece. We did a lot of internal discussion. Our product name was LA Care Covered, so we immediately, through language, connected it to Covered California, so you knew that we were now a part of this marketplace. Our tagline became LA Care Covered for all of LA, because now that was true. LA Care only operates in LA County. Did I mention that? But we probably already know that. So our first campaign, because there's a heart in our logo, and there's an understanding in the organization, the heart represents the members that we serve in the communities that we're in, was a visual of a stethoscope with a mosaic of different cultures and different communities. So subliminally, I like to say, we were communicating that we were for everybody and taking it to the next level. Subsequent campaigns zeroed in. The next year, we zeroed in to communities. I Heart Pacoima, I Heart East LA, because we wanted to interact with you. We wanted to understand, you to understand, the consumers, whether you were a member or not, that we were in your community, that we lived, we worked, we played in your community, and here we are together as a resource. And that worked really well for us. So we started to bring images of different families, different age ranges, and really carrying on this idea of for all of LA. Subsequent campaigns, we went a little bit deeper. The next campaign, we really thought about ethnicity, we thought about gender, because language was only one piece, right? That was our regulatory requirement. We had to produce materials in 11 or 12 languages, I forget what it was. But this next Faces campaign, we took For each of, we had ultimately 5 faces, and each of those 5 faces was a composite of 12 people. So there was a little bit of everything. We really wanted you to connect, and we were thoughtful about maybe looking people, using images and people that could represent several ethnicities, because we were a public agency and our budgeting limit was very low for advertising campaigns, and we of course wanted to be mindful of the public dollars we were spending on these campaigns, but we also wanted people to enroll and have access to health care. Let me see what else I wanted to say about that. The other thing that was happening at that time is that we were expanding our family resource centers. So we are actually part of the wellness center that Dr. Kuo mentioned. That's one of the locations we had. We have locations in Linwood, Pacoima, Palmdale, Inglewood. And these centers were points of interaction. Again, back to this word. You didn't have to be a member, you could be a community member, and you could come in and take classes on a range of topics, diabetes, nutrition, cooking, because we wanted to sort of extend the fact that we were really committed to building healthier communities. It's been fantastic, and I think these FRCs are on schedule to be expanded to even more communities, so we can continue to communicate that we're deeply rooted in this area, and we're deeply committed to making sure that everyone has access to what they need when it comes to healthcare. Well, I'm talking really fast. Do you have any questions so far about that? I'm gonna catch us up on time, so that's really good. So engagement. So this is the challenging piece. We had been in this campaign for a little while. More people knew of us because now we were competing with some of the larger health plans and coming into our own. About this time, we get a new CEO who has a vision for really creating a space for LA Care in this scene in a different way, other than being a public agency, other than being a Medicaid administrator. The vision of John Backus, our current CEO, was that we were going to be an advocate, and that we were going to make sure, given the current climate, political climate, that everybody was going to continue to have access. And we weren't going to be just speaking at the local level. We were going to speak at the state and at the federal level, and make sure that even Washington could understand the importance of having organizations like LA Care in communities so that people can have access to the health care that they needed. So we started this journey of exploring our brand, and what did that mean? So we looked at our logo, we looked at our history, we looked at the engagements and relationships we've had, and we created this whole logo story. Let me go back to our logo. So in the middle, as I said, is the heart. And that was our members, the people that we served, and ultimately the people that we're accountable to, and making sure that they have the services that they need to enter into this era of whole health care and the social determinants. Really be thoughtful of all the different things that were impacting what you did. So the orange sun we saw as the health plans that you had access to: Covered California, Medicaid, Medicare, and a couple of other plans that we have for very specific communities. So that was how we were going to give you that security of health care. The rays in the sun were our community connectors. These are our physicians, our family resource centers, our community partners, the projects that we fund through the community benefit, to just extend the reach and deal with some of these other issues that impact your health. All the things we've talked about today, right? Violence, food deserts, sugar, and all this stuff. And then, of course, the blue was just LA County, because this is where we lived. So this was supporting our initiatives and our way to move forward. So getting back to engagement, the organization had been through change. You know, there's a lot of legislative stuff going on that was changing our dynamics. We were kind of revisiting our quality. We were revisiting a whole lot of things. So we set on this course to identify this brand about 3 years ago. And we started with internal conversations. We talked to all the different levels of our staff to really understand how they saw themselves in this, if they even saw themselves as part of the solution to health. And for me, the most productive conversations, the most insightful conversations were the ones that we had with our call center reps. They more often than not, got a lot of satisfaction. They dealt with a lot of angry people, a lot of unsatisfied people that just needed, needed some things handled. But they also often felt like a hero because every day they had the opportunity to improve somebody's life. Either they made a connection to a service, they made a connection to supplies, and that for me was where we started with this new idea of what this brand would be for the organization and how we would refresh, re-engage, present ourselves in this new political era. So that came up with the campaign Elevating Healthcare in the City of LA. I don't know if some of you saw it. There was wings, because we wanted to take the discussion out into social determinants of health. And for me personally, this is not LA Care at all. I feel like it's a very daunting task to take on social determinants of health, because the reality is we may not ever solve everything. There's always going to be a piece. But it was important for us to create space for this conversation, to add this level of awareness when we were talking about health, because it wasn't just one thing. And I have a little side story about that. I learned about social determinants of health and whole person care during my master's work when I sat down with an indigenous community in Mexico. So they were part of my research. I was looking at biodiversity and how they were using their local environment, local plants to heal themselves. But I came across I'm not going to say the word because I just can't, but their word for disease, for illness, loosely translates to you're not walking right in the world. So how they handled care was the physical thing was sort of the last thing you needed to look at. And there were shamans and healers in the community. You also talked to an elder because their view of it was there was some injustice done to you or that you committed that created a disharmony in you to make you sick. And then there was this spiritual road you needed to go on to sort of correct that or understand that. And then the final thing was the herbal medicine. So to me, that was like, whoa, right? They're looking at the whole person and all the things that impact what they ultimately have as physical health. So this is all side story. This is all running in the back of my head as we're sort of creating this new campaign, Elevating Healthcare in the City of Angels, because we wanted to create a deeper connection. We also conducted an external survey of LA County residents, not our members, just anybody from all different income ranges, from all different zip codes, to kind of gauge what their thinking was about health. And thankfully, most everybody was pretty happy with the healthcare. You know, California is always sort of on the leading edge of what we're doing. And since the Affordable Care Act came in, more people had access to health, and they were happy about that. There was a little bit of security around that. The other messaging that we learned, that we worked through, is that we needed to change our internal dynamics. So here's back to the institutional dynamic, right? We started a conversation of inclusiveness, of diversity, and being thoughtful about this idea of talking to people with dignity and with respect. Always, no matter where you came from, no matter what disability, disease you had, because we understood that really nobody thinks about, I don't think about myself as a sick person, even though I have some heart disease. And most people had this idea that was better than what they were living. Even though they were healthy in a wheelchair, they were still living, they were still achieving goals, they were still interacting with their family and going to parties and having a good time for the most part. So we wanted to focus on supporting that. And elevating healthcare in the City of Angels ultimately wanted to communicate, and this is a multi-year initiative that I'm not going to get to see the end of, but that I was instrumental in developing. Ultimately, we wanted to create this understanding as we were going through our organization and people were introduced to this idea and really engaging, really feeling at a deeper level that they were part of the solution in a way that hadn't happened before. We were all sort of this everyday hero, whether you were an IT person, a call center rep, a senior leadership, a doctor, someone throughout our organization, you were part of this conversation and you had the ability every day to impact somebody's well-being. So that was the end goal, to start to create internally and now externally over the next couple of years, this idea of being co-partners in health, of co-creating a better society, of us being the agent of giving you tools in one specific area and possibly connecting you to other things as we look at social determinants, and being the voice to help you understand, to help you create, to help you manage a healthier life. And so I always think about the Mexican proverb in closing, because I'm a fast talker. There's a Mexican proverb that says, they tried to bury us, but they didn't know we were seeds, which is very powerful, right? Getting back to Jahmal's conversation at the beginning of the day. So how are each of us going to be part of a solution, part of a shift, part of that slow breaking down of these systems and institutions that aren't pre-designed to include us? But how are we going to be a part of a system that allows all of us to see possibilities, right? So marketing and communications is the end game of all the work that you're doing, of the policies you're creating, of the initiatives you're building, of the programs you're designing. So I invite you, I challenge you, as you're beginning these processes, to really think about that dinner table conversation and what that's going to look and feel like once you've got some bad news to give or some good news to give. And how are you going to use language in your day-to-day conversations, in your work interactions, to sort of start shifting? Because I don't see this as a fast. We've been having this conversation for a long time. I've been in multicultural communications for 20 plus years. Dr. Lewis and I have this conversation all the time. And you know, I'm a little pissed, a little frustrated, a little annoyed that I'm still having to say the same things 20 plus years later. But I'm also excited about what's coming, because we're getting more information. You see the data. You have more information to shift these conversations and start shifting some of these things, because getting people to change behaviors, not an easy thing to do. But if we continue to say things in a certain way, if we continue to choose one word over another because this word creates a connection versus a separation, token Hispanic versus, you know, here's our public affairs assistant, which is what I was doing. I get really passionate about this. And creating, looking for new ways to work together out of the box. We talked about sugary snacks. And what inspired me to talk about that issue today was that there's billboards in my community, and there's all kinds of discussion about this, where Coke, Pepsi, and Dr. Pepper have gotten together to reduce their portion size and their sugar. And why shouldn't they? And why shouldn't we demand that they do more? And why can't we work together to change these systems? Right? Okay? All right. That's all I've got to say today. So if you have any questions.